As you know, there has been some bad press related to the rate of arthroscopy in the elderly knee in Australia, and that has resulted in a change of practice as we're seeing in the latest data. So what is the controversy about? Well, as you get older, not surprisingly, arthroscopy makes less difference, and especially once you're over the age of 50, arthroscopy makes less difference than, say, if you're in your 20s and 30s. And the reason for that is the articular cartilage in the knee will tend to degenerate, and so meniscal tearing often in the over 50s age bracket is part of the degenerative process, and therefore whilst you might be able to deal with the meniscus pathology, you can't deal with the rest of the knee with a telescope, so arthroscopically, and the knee will wear out anyway. I think if there has been a specific injury that's resulted in a sudden deterioration, then yes, it's certainly worth considering pending the results of the MRI scan. If there's pain with twisting, squatting, and symptoms of clicking and locking, which may be the result of a loose body, then yes, it may be worth considering an arthroscopy. But really the indications are very specific in the over 50s age bracket. Yes, there is, and that's the posterior horn avulsion or root tearing. So if the posterior horn of the medial meniscus comes off and avulses, then you can have sudden deterioration in the knee with sudden onset of progressive arthritis. That's because the ability of the meniscus to absorb stress is removed, and therefore the knee, the articular cartilage, bears the brunt of it. So yes, there are increasingly repairs being performed in this age bracket, ironically, despite the bad press, with reasonable results. I think the jury is still out on that. But certainly sudden onset of trauma, definitely opt out an MRI scan. If there's a posterior horn avulsion, then please refer on to us for consideration of surgical management.